New to the world of in vitro diagnostics and wondering what IVDR means for you? Let's break it down. The In Vitro Diagnostic Regulation, or IVDR, is the European regulation that governs how diagnostic devices are developed, approved, and monitored in the EU market. It replaced the old IVDD in May 2022 and introduced major changes, raising the bar for safety, performance, and clinical evidence. Under the IVDD, only about 20% of IVDs required notified body involvement. With IVDR, it's closer to 80%. That's a huge shift. IVDR classifies devices by risk, from Class A, lowest risk, to Class D, highest. Your classification determines how rigorous your conformity assessment needs to be. You'll also need robust technical documentation, a performance evaluation plan, ongoing post-market surveillance, and registration in the EU DA Med database. Whether you're a manufacturer, importer, or authorized representative, understanding your obligations under IVDR is essential. And getting it wrong can mean delays, market access issues, or worse. At PatientGuard, we support companies at every stage of the IVDR journey, from classification and gap analysis to notified body submissions and ongoing compliance. New to IVDR? Let us guide you. Book your free discovery call today and get started with confidence.